Hi there, my name is Ty Clark and I am a licensed massage therapist. I'm going to show you today how you can take care of your own knee pain as well as IT band syndrome without any tools. But first, make sure you comment below and let me know which one of these you are dealing with, and you can subscribe to my channel while you're there. As a pro athlete, I suffered from both of these for a long time, and I really have a deep understanding now on how to fully recover from them and to help that healing in my clients. So these methods are tried and true, and they really do work. To start out, we're going to use this pulling motion to get the muscle and the fascia warm. The key to helping IT band syndrome is to get this area to release, even though it is felt down at the knee. We often feel pain at the ends of muscles, but have to help release the fascial adhesions in the middle of the muscle to help with that pain. So try to lean as you pull and use your body weight. You're going to stack your hands and pull the skin, which will, in effect, pull the fascia. The IT band is one long, tight band of fascia, but fascia covers your whole quad and hamstring, so the front and back of your legs. So by using these broad motions, we can affect the muscles and the IT band in that area. Okay, now I'm going to be going much slower and deeper, and I'm unsticking that outer quad muscle called the vastus lateralis from the quadratus intermedius and rectus femoris, as you just saw in that picture. I've sped up the clips because of how long I was holding them, but the key is to wait for a feeling of release or a burning feeling. So it takes patience. Now notice that I am pulling across the leg towards my other leg. I'm not going towards my hip. So I remove my elbow and then I go back towards the other side of the muscle and I pull again across my quad. Now this is key in helping this area release. This is something that I've noticed a lot of massage therapists don't do, and that I feel helps most of all in this area. Now this next part is vital to do, and you need to massage the area between the quads and the hamstrings. And you can see the indentation that I'm pushing into. I'm going to push down and in very slowly. If you're someone who has strained your hamstring or have pain in the back of the leg, this is going to help that as well. And sometimes the hamstring can cause knee pain as well because that tendon wraps around to the front. This area can be a traffic jam for muscles. You have hamstrings and glutes that come together in this area and they just get stuck. We're going to simply press down and allow the movement of the leg back and forth to do some friction over this area. Now, if your opposite leg is flexible enough, you can use this different way of working the same area. You use the outside ankle bone as a tool to pull across and the skin from your foot to latch onto the thigh and pull it over, just like we've been doing in the clips previous to this. I was sitting in class one day and I just put my leg over like that, and I have problems in this area, and I noticed that it was giving me that deep burn that I'm always looking for in this area. And I'm always like, oh, how convenient. It takes very little effort to do. You can pull your leg up and down with your arms. Again, you may not be flexible enough to do this one, but I did want to include it just in case to help those that wanted to give it a try. So go ahead and give your legs some nice relaxing strokes to help realign the muscle fibers in that area, and then we are moving on to the inner thigh muscles. So we're going to work this area to help with that inner knee pain, and this seriously works a lot. Again, you need to work higher on the leg to eliminate the pain down lower. Use the other arm to help with leverage, though you may not need it very much in the area because it tends to be very sensitive here. The knee pain here typically is felt on the inside of the knee and can radiate to the outside of the same knee. And with this movement, you're going to lift that top inner thigh muscle and try to get your elbow to the muscles underneath. You can also use a supported hand to do the same thing. Although, word of warning, this can make these muscles in this area really sore. So take a couple days in between if they are tender to touch. It should start to feel looser even if it is a bit sore. Thank you so much for watching today. Make sure to let me know if this worked for you and check out some of my other videos.